Welcome, dear viewers, to today's episode of Visite. Nice to see you again. And thank you very much for all the letters. And of course, I always choose a bit the priority from these and would like to start with an email today, which an 82-year-old gentleman wrote to me. In fact, he's so worried that he needs to pass water at night and then, of course, does not come to rest. He writes that he's already seen one of the Visite episodes and also listened interestedly when I spoke about the meridian disturbance. And he writes, I didn't understand your statement about the central meridian correctly, but I only have 4 teeth left in the middle. That is, the bottom 4 teeth, all with a root canal treatment and a deep scar. 1 finger across under the navel after colon surgery. I have to tell you that these interference fields can be real interference fields. As biologically holistic doctors, we take such things very seriously. Now, of course, urination at night is possible for many reasons. One is, of course, that the volume of the bladder no longer allows filling within the capacity of the urethral sphincter and to wait a long time, so that the bladder constantly needs to be emptied. The capacities are no longer there. And the functionality of the bladder muscle also depends on the extent to which the bladder is energetically supplied. And interference fields, as we call them, are never where the action is, but always away from it. There is a direct relationship between urination at night and a disturbance in the tooth and jaw area when the teeth are an interference field. From my perspective, that cannot be clarified now, but every dead tooth produces thioethers, mercaptans. That means your immune system has to compensate for an incredible load every day, and it blocks a valuable flow of energy. We call this a functional cycle, and it runs over these 4 bottom teeth via the so-called bladder-kidney meridian, and there is a direct reference here. I always like to give people the example. I have 4 large lamps in my office in the clinic. When these 4 large lamps are lit wonderfully, perfectly, I can actually work 24 hours in this room. But now, for example, the power has been interrupted. That means we only get, let's say, 70% less electricity. That means that I only have 30% light in this room. Then I have to adjust to this 30%. Which of course may be possible during the day. I have the daylight for it, but certainly not at night anymore. I have to leave the room at 5. I can no longer work. This is just a picture that should make it clear to you how dependent the function of our bladder and kidney is on an energy that comes through this pathway. That is 5,000 years of Chinese medicine. If I were in your shoes now, I would see a holistic dentist, and I would almost advocate the extraction of these 4 teeth. Because for me, out of experience, it is already very interesting how often dentists send me pictures of what they experience once they have extracted these teeth, how it causes jaw osteotitis, so inflammation of the jawbone. So I would advise that you should not wait too long to give you the opportunity to achieve an improvement in bladder function here. The scar under your belly button goes through your so-called governor's vessel. This is not a meridian that has a direct relationship, but an indirect one to the others. This scar must also be injected with 1% Procaine. A natural therapist can do that. And when you go on the internet or ask someone to do it, you can find the Society for Neural Therapy, where there is a list of therapists, and maybe you can find someone close to you who can work on this scar. There are different ways to work on scars. It can also be done by laser. You can do it with appropriate electrolyte creams. We use the Jonan cream from Germany. So there are a lot of different things. However, you should investigate this situation. We doctors who developed a different thinking about this interaction and the holistic treatment want to try not to look past interference fields. It may not be exactly the key in every case, but we often observe it. But it gives the body a new power of regulation tomorrow. And you should take this opportunity and keep it in mind. The last thing you write is if you see this as a cause, you may know a means to help or to get better. Maybe also from homeopathy. I have to tell you, dear Gurno, I don't even know that because I am not a classical homeopath. I work with homeopathic complex remedies. But of course, I also know that homeopathy is a therapy that works on the basis of information. And in the context of an interference field, the body can no longer pass this information on. That is why this wonderful therapy is so great with kids. I am giving information and the body regulates. And that's why sometimes a biological doctor is needed who brings the power into the system, which brings itself into balance again and again in terms of regulation, to see why it can no longer do it. Finally, let me tell you about the bladder muscle itself. Each cell has, what should I call it? Each cell has its own energy production, and that depends on Q10 and L-carnitine, on magnesium, on vitamin B12. And maybe you should substitute these things. If you are over 80 years old, then the vitamin B12 absorption is different. Please do a urine test with your family doctor for methylmalonic acid. Or simply determine the homocysteine. Then you see if your vitamin B12 levels are okay. If you take Q10, please also have a Q10 level measured beforehand. And as a rule, it is given about 0.8 to 1. Try to get it to 2.5. That would mean that you invest in the energetic muscular strength, which you may also have lost. And those are things that I would highly recommend in addition at the micronutrient level. To come back to homeopathy again, Homeopathy is very often spoken of with a great deal of misunderstanding. People always make it a bit ridiculous and think that if you were to examine the water now as a chemist, or just a few homeopathic drops, you actually find nothing but water. But I like the comparison that when a chemist examines a CD that contains billions of pieces of information, then they will find that it is only made of polycarbonate. They cannot prove anything about the information on this CD. And that's why I want to ask everyone who have no experience with homeopathic treatment, if you cannot judge as if it were nothing, because our body only regulates via information. And if you want to understand life at all, it's all about deciding at the cellular level. Electrons, protons, information interlock. And maybe it is not enough that we focus on this level of life in depth. We go so deeply and understand it. We are always directed very quickly, even today, medically, only to give as a basis for validity what we can also prove. But I hope that I could help you a little now with the question of your urination at night. I don't know how large or less large your prostate is. Saw palmetto extracts ensure that the prostate, which is physiologically enlarged, because men too, when they get older, go into a different hormonal structure, and precisely because of this hormone change, the prostate can respond very, very specifically with an increase in size. These are also things you might solve with a saw palmetto extract that shrinks the prostate by up to 30%, and it can be helpful for urination at night. I want to recommend this at this point, or pumpkin seed extracts, but I have the impression you may already be familiar with these things. This was the first email, and maybe I may, because we still have a little time, read a second email, and that comes from Elisa. Elisa is writing to me, I want to write to you today because I have an ovarian cyst. And I had an operation on this ovarian cyst. And then they actually wanted to check this ovarian cyst again after 2 or 3 months. And the ovarian cyst has continued to grow again. So there was a new ovarian cyst. And then she received a hormone preparation. And after taking that hormone preparation, the cyst no longer reappeared after another checkup. After 2 or 3 months. And now, of course, she asked me the question, what can I actually do? I either have this cyst or I take a hormone supplement. And actually, I don't want to take hormones at all. I can't tell from this how old you are, but maybe that doesn't matter. Perhaps one should always keep in mind that cysts are an encapsulation and an expression of iodine deficiency, especially ovarian cysts, especially thyroid cysts. No matter where we find cysts or fibrocystic mastopathies, cysts in the breasts, we know today, they go back to an iodine deficiency. I advise these women, of course, that you first have to see how high your iodine level is. You can't actually measure that directly, but you can do a so-called iodine test. This iodine test would be done with Lugol's solution. Take 2% and spread it on the forearm 6 times in a square, and just watch how quickly this iodine is absorbed by the body. A very good comparison parameter, for example, is to have the thyroid hormones examined. And not just the TSH, also the free T3 and T4 and the T3 reserves. The thyroid is, of course, the main consumer of iodine. And if the thyroid gland claims the iodine for itself, and thyroid levels are all in order, unfortunately, it doesn't mean that iodine is in balance. We need iodine incredibly. We need iodine for ovulation. Iodine increases the production of progesterone. Iodine is one of the most important antioxidants. Iodine is important for the production of T4. The thyroid hormone, 4 iodine atoms are incorporated there. Iodine protects against cell changes and has a high anti-tumour effect. It has a disinfectant effect. Iodine has a very strong detoxifying effect, especially for bromine. Toxins such as aluminium and mercury are discharged through iodine. Iodine makes you very calm, and iodine disinfects. So, iodine has an antibacterial, antiviral, antiparasitic effect. We see iodine deficiency more than we think. And this iodine, which you then see how quickly, within a few hours, this iodine tattoo is removed, then you can apply this iodine. You can still work with this 2% iodine solution, Lugol's solution, because it contains the components of iodine and iodide, which you do not have in normal table salt. And when you put this iodine on the skin, and maybe especially on the stomach, you can do this every day on the right and left in the lower abdomen, where your cysts are. If you take in iodine, you are happy to take it. A 5% Lugol solution, and combine it with an iodine protocol. This iodine protocol is iodized salt protocol. We simply use Himalayan salt, a crystal. Put it in a large glass. It can be 500 or 250 millilitres. Let this Himalayan crystal salt dissolve. We call this a living brine. All elements of the periodic table are in this Himalayan crystal salt. Take a teaspoon of it every day and drink it in the morning. And please keep pouring water as long as you can still see some undissolved Himalayan salt at the bottom of the glass. If you then take this iodine as a 5% Lugol solution, then there are 7.5 milligrams of iodine in 1 drop. This is little. So you can take it and you can also put it on your skin. Carefully, always the 2% solution. I would not apply 5%. It can irritate the skin too much. And you can increase that from week to week. Because if we had a reactor accident in Switzerland or Germany, we would have to give you over 130 milligrams of iodine to protect the thyroid gland. So you only have 7.5 milligrams in a drop. So you can increase that from week to week. An iodized salt protocol accompanies this iodine therapy. Also start with the salt protocol and then take the first dose of iodine. Then the body is also prepared. And it's still interesting that the iodine cofactors are also integrated, such as magnesium, zinc, and also vitamin B6. If you take these drops, 1 more drop every week, and notice that the body is actually saturated, of course it would heat up the thyroid metabolism a bit. When too much iodine is ingested, you will really feel that by yourself, how high your dose will be. This is a very sensitive event and incredibly important and valuable. And then just go back again. This is some kind of swing therapy. You slowly buffer up and then you go back again. And you are also very welcome to put the iodine exactly where the cyst is. And then I would be completely relaxed and would just do another ultrasound after a period of maybe 3 or 4 months. But I would no longer counteract this hormonally. And with iodine, the supply of iodine, we actually help ourselves within the framework of all cystic change, especially the breasts. Love iodine incredibly. And remember, if you don't have cysts, you might as well put iodine on your breast from time to time. Or by doing an iodine test, you can determine your own iodine levels. Or if you tend to hypothyroidism, this is really a great and valuable thing to do. So if you follow the iodized salt protocol, then I would ask you cordially to take the cofactors that iodine needs in order to be well metabolized in the organism. That's selenium, that's zinc, that's iron, and that's vitamin A. And you are welcome to take these cofactors individually. And please remember to measure selenium levels as well. The levels of selenium and zinc are measured intracellularly because both are elements found in cells and not extracellularly. That is important for the iodine protocol that should be successful in the end. And the many tasks of iodine in our organism, with an unbelievable variety to protect against free radicals, and thus also to protect the cellular metabolism for detoxification and the antiviral bacterial effect. But if you incorporate that, I believe after 3 or 4 months, if you have another ultrasound checkup, hopefully your personal tendency towards cyst formation can actually get back under control without having to take a pill or contraception. By the way, a small note, every pill intake influences the B vitamin metabolism. That means if you take the pill, you absolutely must take B vitamins. So there are a number of interactions of this drug or the pill with our high-quality micronutrients. Just as a side note. With this in mind, I thank you very much for your letter, Elisa, and I wish you all, dear viewers, a wonderful Sunday evening, and I'm really looking forward to the next time. Goodbye.